Hello everybody and welcome to the Thursday edition of Video Clips. And I ended the Tuesday broadcast with some information about cancer treatment and costs, and we're going to continue along that theme and talk about alternative cancer treatment today. Fortunately, here's the good news. More cancer patients are aware of the limitations of traditional treatment for many types of cancer, and so they're seeking alternatives. In fact, research shows that most cancer patients are using complementary and alternative therapies as part of their treatment plan. But most patients don't tell their doctors that they're doing this, and one of the leading reasons cited for this is that they fear that their doctors will not be understanding or even allow them to do it. And there's some reason for them to be worried. Not all doctors are very understanding. CAM treatments include but are not limited to things like diet and vitamins, minerals, meditation, herbs, yoga, massage, acupuncture, hyperbaric oxygen therapy, and hyperthermia. And I'm going to do a video clip next week on hyperthermia because I think it's worth spending some time on. There are literally millions of websites that promote alternative cures for cancer, some better than others, some treatments better than others, many of them supported by nothing more than stories and testimonials and exaggerated claims. So I think it's really important to be very, very careful. On the other hand, there are a lot of non-traditional treatments for which there is a tremendous amount of evidence to support some efficacy, like hyperthermia, which is why I'm going to talk about it next week. Well, a common question when cancer patients start looking around is whether or not alternative treatments can be used in place of traditional treatment. In other words, is it possible to avoid all traditional treatment and just use diet or several other natural approaches? Well, it's difficult to answer this question in a scientific way, and there are all kinds of reasons for it, one of which is that the answer may depend upon what type of cancer. Some cancers are very slow to progress, which gives you more time to try other things, while other types of cancer progress much more quickly. Another issue is that there are so many different treatments used in so many different combinations that it's very difficult to conduct research on all of the things that are out there. And then there's the challenge of having no financial incentive to try to research a lot of these things. I mean, if you're in the cancer treatment business, a blockbuster drug can make you hundreds of billions of dollars, and you're just not going to see that with a supplement or heat treatment or something of that nature. So a study comparing people who get no treatment of conventional treatment versus non-traditional treatments, difficult to conduct for those reasons. And then there's another reason too, which is that at academic centers and cancer treatment centers, it's considered unethical to withhold traditional treatment from patients, even if the traditional treatment has been deemed to be completely useless. In other words, there's this mentality that you just have to do something even if it's wrong for people. So anyway, I think it will probably be a long, long time before we have good answers to these questions, and that really puts cancer patients at a significant disadvantage. The closest we can come to an answer, I found one study that I thought was pretty interesting. It was last year, appeared in the Journal of the National Cancer Institute. Even this study has significant limitations, but I think it serves as a good warning to cancer patients to be very careful about the decisions they make. So here's what happened. Researchers at Yale identified 280 patients who had either colon, breast, prostate, or colorectal cancers and had chosen to have what was termed other unproven cancer treatments administered by non-medical personnel. That was the term that was used. These patients didn't receive chemotherapy, radiation, surgery, or any type of hormone therapy. Instead, they got non-traditional treatment. So the individuals were more likely to be female, younger, have higher incomes and higher education, so there probably was a little bit more deliberation involved, and also more likely to have advanced cancer. But the study didn't exclude people who had metastatic cancer and stage 4 cancer. They were excluded from the study. The comparison group, on the other hand, was 560 patients who had conventional cancer treatment and were matched based on cancer type, age, clinical stage of cancer, morbidity scores, insurance type, race, and year of diagnosis. All the patients were followed for an average of 66 months, and that's important because in the cancer business, 5 years of survival from the date of diagnosis is considered the benchmark. Those patients who chose to use only alternative therapies had significantly worse mortality rates than the ones that opted for conventional care. The magnitude of difference was worse for breast cancer patients, with those using only alternative treatment having a 5-fold increased risk of death when compared to those who had conventional treatment. Patients with colorectal cancer had a greater than 4-fold increased risk of death than colorectal cancer patients who got traditional treatment. Lung cancer, it was a 2-fold increased risk of death. There was no difference for prostate cancer patients, and it was most likely due to the fact that prostate cancer is such a slow-growing cancer, which might mean that prostate cancer patients are better candidates to try something completely alternative before they embark on conventional treatment. Maybe they wouldn't even need it. In fact, there are a couple of studies that do show that. The authors note that there are limitations to their research, and I think this is very important, which include the fact that alternative medicine, as defined in this study, is not the same as complementary and integrative medicine, because in this case, alternative medicine was defined as an unproven method used alone instead of conventional care. This is distinctly different from the use of several types of treatment, both traditional and alternative, that are put together in some type of comprehensive plan in consultation with a health provider or a treatment team. And so I think the things that are important to point out here is that it's very easy if you're looking at websites with testimonials and that sort of thing to think, oh, I'll just go try that. And just trying that instead of traditional care is not likely to lead you to the outcome that you're looking for. This needs to be handled differently, and I'll get to how to do that in a minute here. The results were worth thinking about. I'm going to give you the quote from the end of the article. Overall, 78% of people having conventional treatment for cancer survived at least 5 years, compared to only 55% of people having alternative treatment alone. That's a pretty big difference in death rate. Now, there are no studies that have looked at the comprehensive, well-planned cancer treatments for patients that I mentioned earlier, including those that were comprised of only alternative care. The closest thing we have is Dr. Kelly Turner's survey of terminal cancer patients who survived long past their life expectancy, which she reported in her book, Radical Remission. From these patients, we can draw some very important conclusions. First, the patients were thoughtful in making their choices. Again, this is not just looking at a website and jumping off the deep end and saying, I think I'll go take this supplement and that's just what I'll do. They were described as annoying by their doctors because they treated them more like consultants and didn't always follow their advice. They used a combination of treatments, which they discovered by constantly seeking information and carefully evaluating their options. So they started with a plan, and then the plan changed and expanded as they went through the process of recovery. And they shared important attributes which are hard to measure in clinical trials, like strong reasons for living, improved emotional health, and deepened spiritual connections that they thought were crucial to their survival. So I think the best advice we can give cancer patients is to consider options carefully and to understand that the key to survival is not choosing a camp, like I'm doing conventional or I'm doing alternative. It really is in combining the best of both worlds and all worlds if necessary. And I'll give you some examples. Like, many of our members have chosen to have surgery to remove a tumor, but they've carefully evaluated follow-up treatment and just decided it didn't offer enough survival advantage for them to do it. Some have decided to use diet and alternative treatment first for very slow-growing cancers, and to use conventional treatment as a backup if adequate progress is not made within a specific period of time. So even when something alternative is chosen, there are deadlines and measurements and things of this nature. Some have chosen to undergo a water-only fast. We send people to a center in California in order to shrink tumors prior to surgery. And some have chosen to do everything recommended by their oncologists, and then to lose weight, improve their diet and lifestyle habits, and do an awful lot of what would be considered alternative treatments in conjunction with those traditional treatments. So I think the bottom line is that there aren't any wrong choices, but there are some very impulsively made choices. Those are the ones that don't work out so well. So I think there are no wrong choices, provided the choices are well thought out, the patient has confidence in the choices that are made, and is open to changes in the plan as may be required. So when I was talking to somebody about this article, and they said, boy, that's really depressing, because I think we want to see better outcomes from alternative medicine. And you know, I think the better outcomes in healthcare in general are when we don't try to do one-size-fits-all decision-making and treat people like they're machines. I've often said a major shortcoming in healthcare is trying to treat people like cars. You know, you've got an operations manual for your car. Something goes wrong, you go to the index and it says go to page 84 and change the light bulb. That's not how you treat human beings who have health issues. It's much more complex than that. And so I think we have to recognize the complexity and get people to really think through their options carefully before deciding. So I think it's not bad news. I just think it's good information to know. And there's a difference between those two things. All right, as usual, if you like what you saw today, you can hit the subscribe button and join us. Remember, we're doing drawings periodically to give away certificates for courses and that sort of thing. So we're going for that 25,000 mark. So get your friends to subscribe too, so we can have our first drawing. And as usual, pass this on to anybody who you think would enjoy watching it. And I'll be back to you next week with more news.